Hello, everybody. This is Dr. James Hawkins here. I'm a certified EFT trainer from the International Center for Excellence in Emotionally Focused Therapy by Sue Johnson. I'm excited to just have worked in the Memphis area on some EFT trainings. And I have one of the community leaders for EFT in Memphis here with us, Melissa Bosserman. And she is one of our newly certified EFT therapists. Well, I shouldn't say really newly, because hopefully she'll be an EFT supervisor after a while. But I just wanted to take a moment and interview Melissa to talk about EFT in Memphis, about what it means to bring EFT training there, how my hope is really my heart was really touched by the Memphis community. And so I want to help support therapists there in order to be able to help support the families, couples, and individuals of Memphis. So, Melissa, thank you for being here. I appreciate you.
Yeah, so good to be with you today, James.
Yeah. So, I got a couple of questions just to help people understand. But, Melissa, what would you say is the value of of formal kind of the ISEF way of EFT training in the Memphis area?
The thought that comes to my mind first is just how many of our new therapists who have gone all the way through the training have said over and over and over, this feels like home.
Mm,
And I think, whether it's for our community of therapists or it's for the couples and the families and the individuals that we're serving, that at the root of EFT, we want people to feel like they're at home, both within themselves and with each other.
wow. And I like that because, as we talked about this a little bit, and that home being really that attachment frame, that attachment theory as a way to give context for the relational and emotional distress that individuals, couples, or families can be going through, coupled with the interventions of EFT to help work with the attachment related distress. Yeah.
That's exactly right, James. And I think, when therapists first go through externship, I think it's that attachment model, just being able to see that bigger map that helps us feel more secure as therapists.
Hmm.
Like, oh, we can actually name these things. And then there's a place to go next. And even just kind of feeling our own bodies having a place to go is such a powerful experience.
Mm. I like that, Melissa, and I appreciate your heart for new therapists and for all therapists, because that's why many people don't work with couples and with families, right? There is an EFT for individuals, which I really like, but we definitely know we need more people to be able to see couples and to see families. But therapists have a good reason for why they don't. And I like what you're saying. EFT provides a map. And what does Melissa mean when she says that? Is in EFT, yes, we have the steps and the stages and what we call the tango, but it is a clear frame that has been researched and proven the APA gold standard for what it means when people come in clinical levels of relational and emotional distress. What are plans and what are interventions to be able to walk them through stages of de-escalating it, restructuring their bond, and then consolidating the growths and learning to be able to then go and work on and finish the work of their relationship at home. And you're right, if you don't have a map when these couples negative cycles of interaction and these behavioral patterns that they're in, if you don't have a map for it or a frame for it, it will eat your lunch as a therapist. It can feel so discouraging. It can make going to work hard. But I like, even as you said it, Melissa, you were like, it's I have a map. And like you just pulled it into your body. And like,
Yes.
yeah.
Yes. Well, I was thinking about something that you said early to me in supervision, James, of so every because it can just make it so simple. Every couple, every family system that comes to us, they're unorganized. Some of them are unorganized in like a couple of ways, and then some of them are unorganized in 100 ways.
Hmm.
And, our goal, just so simply put, is to take that which is unorganized and help it become organized.
Wow. Yeah, I like that. Help that which is unorganized, help it become organized. Because then when you do that, going back to the attachment frame, then their attachment system can take over to reach for comfort and connection in times of emotional distress. I
That's
love it.
exactly right. And even as therapists, I mean, so an unorganized system can really come into our office, our space,
Mhm.
and really trigger our own unorganized parts, our own scared parts. That thought of that I hear so many therapists say about feeling like a fraud.
Mm,
Uh-oh, I don't know what to do here. Now they're scared and now I'm scared too.
mhm,
And I think, you know, what we're trying to build in the EFT community is not only a space where people can really learn this map and have the tools,
mhm,
but also a space where we can kind of all come together and just use that shared connection to feel stronger in community, to feel like there's somebody to go to, we've got each other's backs.
mhm.
I think our team is really emerging into a team that's good
I
at that.
agree. Yeah, can you tell us a little bit more about your team there and like when you meet and if other people are interested in EFT, maybe how they can get connected in community with you all?
Absolutely. So we're meeting third Monday of every month at 11 o'clock on Zoom. And currently, it's been our small group that has already been through the training. We've been working hard to kind of collaborate, but we're hoping. You and I are talking about ways to provide some training, provide just some modeling, help people understand more about what EFT really is, and get a feel for it. So we'd love for other people to begin to join us on that journey.
Okay. So, Melissa, I really appreciate, and you're right. Let me make sure I tie together the good words you've been saying. That why we're excited about EFT in Memphis is to help people have a clear frame, which is attachment theory, for making sense of our individuals, couples, and families for the emotional and relational distress that they get stuck in, and that EFT provides a map, not only just to help the client, but for you as a therapist to be able to say, you know what, I'm not just winging it here. I'm not just guessing here. I'm not lost here. I'm not saying it makes it completely like, oh, this is no thing, but like EFT says, no, right where we are is right where we're supposed to be. And this is what we're doing here. And this is where we're going. So, at least as you as a therapist, you have a frame, which one, that is great for your couples, but guess what else? Let's be honest. It's good for you as a therapist. So that way, even when you want to market yourself, you have when you go through EFT training, you can show like I've got the hours, I've got the practice, I've got the reps. People have watched my tape and vetted my work, and so it's like people like they will seek you out, like they're seeking Melissa out. Melissa has a waiting list of couples and families and individuals because she's put the time in, and now she knows what she's doing, and that word of mouth is going to continue to spread. But as I was in Memphis, I see that there's a lot of need. And so my hope is to train more therapists. If you're a clergy person, if you're an HR or whatever, and you want to know how more to help people in emotional and relational distress within your particular setting, we want to encourage you to come to an EFT externship. Now, here's the issue: we need to get a number of you ready before we can just come there because it is a big endeavor to put on an externship. And the last externship we did in Memphis was a smash hit, and we did it hybrid. So there were some people live, there were some people online. My hope is we can pack out a room of maybe 50 clinicians live in person in Memphis because I know your city needs it. I know your people need it. And I know that I can see the hunger and the desire of the therapists in the Memphis area who want to get better at what they're doing. And so we want to help you do that. I know Sue Johnson wants to see Memphis thrive, name drop in there. And even for Sue, I said, Sue, when you get in moments of distress, even now after all these years, and clients are yelling and they're mad and couples are angry or families are angry or your individuals are just bound by anxiety and depression. What happens for Sue Johnson? Now, this is a guru in the field, right? She's going to be in our books for years to come. She says, I ground my body and I remember I have a map. And that's it. That's what EFT does for us. It's, I know there's distress, but we have a map and we want to help you as a Memphis community. So we don't know all where this video will be posted, but you can maybe comment you can put your comments in the comment section if you be interested in it. Melissa, is there a way that they could reach out to you if they're interested in EFT? maybe being a part of
Yeah.
the community or being a part of a future training?
Yeah, yeah. My website is melissabosserman.com. We can put that in the link as well. There's a easy way to message me on there.
Okay.
Um,
Yeah. And you can reach me on my website, dochawklpc.com. Same thing, you can reach out and say, hey, I'm interested. And then Melissa and I will put that together. And you can follow us also. You can go on, they could do this one. This will be it when they could go to on Facebook. You can follow us at Memphis EFT. And then on Instagram, right now, we're just calling it Mid South EFT. So you can find us at Mid South EFT and follow that way. And then that way you could be kind of in the stream of know about what's coming up. If you have any further questions, man, share this. If you're part of a university there in the Memphis area, let your professors know, let your fellow colleagues know. We'll be offering student discounts. Like I said, maybe pass it on to your clergy leader of your faith community or just so many ways. This is good. Who can come to EFT trainings? Externship, anybody can come. But to be able to be certified and go on into further training, you do have to be a clinician. You can be a student and continue. If you're enrolled in a master's level training program as a student, you can also be a part of training in emotionally focused therapy. Thank you so much, Melissa, for your time. And I'm excited for what you and the team of people, I wish we could have them all here. I really
Me
appreciate
too.
but it's a
Yeah.
core group of 4 strong clinicians, leading up the charge in EFT, and so thankful for all of you.
Thank you so much, James. I think that's one of the best parts about EFT is just the support that like even that Memphis is getting from so many different areas. And we love that.
All right. Thank you all so much. Appreciate you.